And we're going to talk a little bit about the community care continuum and what that means, and also a little bit about our stages of integration and models of HIV service delivery. And then we're going to jump right into the training package and some of the approaches and the contents and the components of that package, and then we'll go over the self-assessments, which you will be handing out to your providers. Okay, so the roles and responsibilities as we move forward through the training package, and hopefully everybody's had a chance to look through this, and if not, no problem. We're going to be going through it today in detail. What our roles and responsibilities here at the NCHCMC are really to provide guidance around developing HIV clinical learning and training, conduct and evaluate the site and the individual clinician using our assessment tools, and we're going to talk a little bit about that. Provide assistance with developing the training plans to best fit the goals and capacity of the health centers. We're going to talk a little bit about that as well, and that's something that you all will be engaging in hands-on when you come visit us in April. And then we're going to also assist with the coordination of various mentors and the staff, and at both here and at your sites, to help make sure that your training experience is the best that it can be. For the clinical learning leaders, these are the clinicians or the staff on site that are going to be sort of the leads for this clinical training. They're really going to be serving as the liaison between the health center care team and the AETC, NCHCMC staff. Really going to develop and oversee the clinical training plans, define a schedule for training in conjunction with whoever your leadership is at your site, and communicate with the AETC around specific training needs. For members of the care team, these are actually your clinicians, your nurses, your docs, your mid-level providers who are going to be engaging in this training. Their roles and responsibilities are obviously going to be to participate in the clinical training opportunities, really establish what we're seeing here, some of the time commitments that are going to be required. Obviously, this is definitely flexible and to be determined by leadership, and then obviously the individual training will be determined by the provider, and that's something that the clinical learning leader can work with the individual provider around. And then monitor progress for the individual training as they progress. That's something that the individual clinician can do on their own. And then very important is going to be to complete the evaluation pieces for the various trainings. So what is the community care continuum? And this is something that, that you may or may not have heard about from us so far. But really what it is a framework for integration of HIV care into primary care, something that all of us have in common as we move forward here. This is what we're hoping to accomplish. It really allows us to classify our community health centers and classify you all based on two different systems, if you will. The first one is the clinical stages of HIV care. It really helps to classify the CHC based on what type of care, what clinical level of care is provided to people with HIV. And then our integration model, which classifies the sites based on the method by which they provide that care. And this is something that you all encountered on the training needs assessment that we originally sent out, where you were asked to classify yourself within these two different spectrums. And everybody did a really great job in responding to that. And here you see our clinical stages of care. Again, this was explained on the training needs assessment. And foundation stages to provide HIV testing, but no medical management for patients with positive test results, and on-site management of stable HIV positive patients who are antiretroviral naive or on first-line therapy. That would be stage 1. And then it progresses down through stage 3, which is really that most complex level of HIV care. And I see a question from Deidre about explaining the individual training. We're definitely going to go through that in a few slides, and we'll take a look at exactly what that means for each of the individual providers. Great question. When we look at our integration models, again, this was on the training needs assessment. We're looking at external HIV care, which is HIV testing, but no medical management for HIV patients. And remember that this is really the whole site that we're talking about. So if there's a contracted ID specialist that comes in, 1/2 day a month to see HIV patients, really that's still considered external HIV care because the whole site, the providers are not at the level where they're able to provide comprehensive HIV care. And then it progresses through collaborative care, which is HIV care within primary care with, of course, extensive collaboration, supported care, and then again at the top, that comprehensive HIV care with mentorship or clinical consultation as needed. And bringing those two classification systems together really forms the community care continuum. And we'll be talking a lot more about this in depth at the community meeting, but this is really just meant to be sort of an introduction, and you'll be able to see sort of where your site falls into that community care continuum at the community meeting as well. But it really is just a framework to provide a stepwise approach for developing capacity building around HIV care. And the goal is to really meet you where you're at and move you up one step in the continuum. And this is the model graphic for that continuum. So say if somebody is down at external HIV care, maybe providing testing but no actual medical management, the goal would be after a year in the project to be moved up to stage 1 and collaborative HIV care. So what is our approach to training? Really what we're offering is something called the HIV Training Package. And what it is a set of learning resources and tools to help the provider in the primary care learning community. We hope that it allows you to gain the necessary skills and knowledge that you need to provide that next level of HIV care in your community health center. And it includes a lot of different resources, which we're going to talk about in the next few slides here. So what it is it's assessment-based, and we're going to talk a little bit about those assessments here. And it's self-directed, so if your providers choose to move through it individually, there's an ability to do that. It's very flexible. There's a lot of different ways to access the training package. There's a lot of different media that's included in the training package, including PowerPoints and CME opportunities and things like that. It's accessed mainly through the Virtual Learning Lab, which is a secure online website, which you will all be given access to, where you can go in and actually look at the learning proficiencies. And I'll talk a little bit more about that. And it's also going to be available in hard copy form. And the Virtual Learning Lab is something that, that will be introduced to you in depth at the community meeting as well. Okay. So the training package is really to provide support for the prescribing providers, the RNs and LPNs, LVNs, and then other care team members as needed. So what the HIV training package is broken up into is it's really broken up into clinical stages, and it's broken up by discipline. So each discipline, LPN, LVN, and MAs, have their own set of what we call learning proficiencies. An example of a learning proficiency might be for LPNs, MAs, might be providing universal precautions in the clinic, for example. So that specific proficiency will then have a set of core resources like you see on your screen, most likely in the case of the HAB guide for HIV/AIDS clinical care and ANAC core curriculum for HIV/AIDS nursing. And then also a set of supplemental resources which would include various online presentations, various CME opportunities or case studies, or internet-based learning resources that might not necessarily fall into our core resources. So each proficiency comes with its own set of resources, its own set of learning materials that is very specifically geared to that particular topic in that proficiency. Now, all of the proficiencies are organized into what we call a curriculum menu, and the curriculum menu is again organized by discipline and organized by clinical stage. So, for instance, if we're talking about providers, there is a specific curriculum menu for providers who fall into that stage 1 level, or for providers who fall into that stage 2 level. And so just as there's a specific one for mid-levels and physicians, there's also a specific curriculum menu for RNs. There's also a specific curriculum menu for LVNs, MAs. And there's a curriculum menu for the foundations piece as well. Let me put a graphic up here for you to look at really quickly. So this is an example of a curriculum menu page, and there are 2 ways to access the curriculum menus. One of them is in this Excel version that you see in front of you, and I apologize, it's pretty small to see, but on the left-hand side you see the list of proficiencies, and then scrolling across you see the core resources that are available and the supplemental resources that are available. So each proficiency has those core resources and the supplemental resources, and our hope is that for the corresponding proficiency, the provider, the nurse, the clinician will move through the core and supplemental resources to complete that proficiency. So here's just a Word version of the document, and all of these again are accessible on the Virtual Learning Lab, which we'll go over in much more detail at the community meeting. Here what you have is again the same content, just in a different layout. So this is the Word document that's available, and you can see here Proficiency 1 is diagnose and manage acute retroviral syndrome. The core resources here for the clinician to work through around this topic are the HRSA-HAB manual, and this is a PDF file that you can link right from the page, and then the DHHS guidelines that are specifically around the management of acute retroviral syndrome. And then, as you can see, we offer a CME here that's available, and then some point-of-care resources that are also available. And the really nice thing about this package is that your clinician can log into the Virtual Learning Lab, click on their stage, so their stage 1 or stage 1 providers, click on their stage, and then a list of the proficiencies will be available, and say they want to include Proficiency 1 in their training plan, they can then just go to Proficiency 1, click on all of these links, and they'll be able to access the learning materials that they need. Now, the monitoring framework is a really important piece of the individual training. What it really is let me put a picture of it up here for you. What it is a very easy to use framework that's available for the provider that they can keep on their own, definitely use in conjunction with consultation from the clinical learning leader, so the clinical learning leader can keep up to date as to what exactly is going on. What this is an opportunity for the provider who's actually going through each proficiency. They'll be able to click on HIV learning resources introduced, so say they read the material or they looked at the material, they can click there, and then if they reviewed and completed the material, they can click there. If there's an opportunity to discuss in a group forum, they can use that and mark that off. If they receive specific mentorship around this issue, they can mark that off as well. And then most importantly, if they went into clinic and saw a patient who had acute retroviral syndrome and used that knowledge that they gained to manage that patient, they can click Apply the Proficiency. And it's really meant to be a nice way for the provider and the CLL to keep up to date on what exactly which training is going on in the training package and in terms of the individual training. Now, Deidre, you asked a question about the individual training and what that would look like. This is a highlight of the individual training. What that would look like is each provider, let me move through here. This is some of our supplemental tools. Why don't I go into talking a little bit about the provider assessments, because we have to talk a little bit about that before we can go in and discuss sort of what the individual training will look like. This is what we're going to be emailing you shortly. Some of you may have already received this in an email electronic version already so that you could take a look at it. These are called the self-assessments and proficiency list. And we've broken it down by clinical stage and also by care team members. So again, LVNs, LPNs have their own self-assessment and proficiency list. RNs have their own self-assessment and proficiency list. And then providers in stage 1 have their own self-assessment and proficiency list. And providers in stage 2 have their own self-assessment and proficiency list as well. And we will be giving you, we will be sending you the self-assessments that you need to pass on to your care team members to fill out. And you can return them, to us either electronically or via hard copy, whichever is easiest for you at your site. But either way, we'll be able to tally all of the information that we receive, and we'll review it together at the April community team meeting. So let's go through this training plan, because it's really important that the clinical learning leader be able to give any guidance or assistance to the care team members who may be filling this out. And let me just pause really quick. It looks like we might have another question here. Is it appropriate for the clinical health educators to participate in the learning activities? That's definitely fine. They may be able to participate in the learning activities under the foundations piece. Our foundation stage is really geared towards clinicians who may be in the clinic but who may be just wanting to get a stronger baseline knowledge about HIV. It includes a lot of baseline things, including like kind of the pathophysiology of HIV, how does it work in the body, what are the basics of the epidemiology in the United States around HIV. So that certainly could be something that you could pass on to your health educators or other clinicians, quote, who might be working in the capacity but are not captured on the care, or who are not captured under those sort of headings of provider, RN, or LPN, MA. So definitely. And then you could just let us know. We'll send the foundations assessment, and you could just pass it on to those team members. So in terms of the self-assessment here, really what we're looking at, this top part here is pretty self-explanatory. You know, their name, identification info, their credentials. We would like to know if they're an MD or an NP. Specialty, if applicable, that becomes really important if you're planning to give this out to an OBGYN or a pediatrician or family practice doc, or even a pediatric nurse practitioner or a certified nurse midwife. That's really important information for us to have so that we can sort of take that into account as we look through these self-assessments. And going down to the organizational name, also self-explanatory. The site name is important if you are going to have multiple sites that are participating, just so that we can get a sense of how many providers are at each site. So that is something also too important to include there. And also here, you can see there's a checkbox also to check. Other prescribing clinicians, again, would include dentists, would include certified nurse midwives. I'm sure none of you probably have nurse anesthetists on staff, but any of the other sort of prescribing clinicians that might not fall into that those 4 categories up above there. Okay, so now in getting down to actually how do we help our clinicians fill out the self-assessment form. And really what this is meant to do two tasks. The first task is to allow the clinician to rate their competency in a particular proficiency. So remember, the proficiency is kind of those topics that we're hoping to train around in terms of providing HIV care. So again, this is looking at the foundation stage. This is for providers, but we do recognize that providers in stage 1 may need some level of foundational training around HIV. So this gives them an opportunity to incorporate those as well and not just jump to the stage 1 providers proficiency. So let's say, for example, I'm a provider here and I'm looking at this self-assessment. And it says, assess your current competency in each using the scale below. And really it's a 1 through 4, a 1 being I'm unable to perform this proficiency, and 4 being I'm able to perform this proficiency independently. Number 2 is I'm able to perform this proficiency with direct HIV expert guidance. So this would be somebody who's on site, who's an HIV expert, and as me as a clinician who's maybe just learning this information, I would say, yeah, I could kind of define some of the current trends in epidemiology of HIV infection in the United States, but really I wouldn't do that independently. I would only do it with an HIV expert right there assisting me with that. Or perhaps more appropriately, I would never manage acute retroviral syndrome without an HIV expert right there over me, assisting me. And then number 3 is a little bit more in between. I'm able to perform this proficiency in consultation with an HIV expert. So this would be me saying, actually, I can manage acute retroviral syndrome, but I would need to call up my clinician, my clinical expert or my clinical consultant and just run the case by him. And then again, number 4, I'm able to perform this proficiency by myself. I don't need any assistance. So that is really, those measurements are really what go in column A under please rate your competency in this area. So that again gives the clinician an opportunity to sort of rate themselves. And then in column B, we ask you to please also select the proficiencies you would like to include in your training plan. And this is getting back to that original question of what does that individual training look like. And this is very helpful for both the individual and the group. First, with the individual, it really allows the clinician, and let me move to the next page here so that we can get a little bit more into the actual clinical pieces. It really allows the clinician to tell us whether or not this is something that they feel they need training on. So they may say that, well, I can appropriately order and interpret baseline HIV-related lab tests. We're looking at number 3 under the proficiencies for provider stage 1, part 1. So I would say that I'm a 2 here. I can do this, but I have an on-site HIV clinical expert who is assisting me to do it, who I run the case by. So I would put myself at a 2 here. So I would like to, yes, learn more about this. So I would then click this box and say I would like to include it in my individual training plan. And then that would be a cue for me as I go through to begin my proficiencies and begin the actual learning, the actual training process, that I would need to then make sure that I run through all of the resources in the proficiency 3 under provider stage 1, part 1. And then I could note that on my monitoring framework. So again, 2 pieces. One is allowing the clinician to rate themselves, and then the other is allowing them to tell us whether or not they would like to include it in their individualized training plan. This is also really important for us because it helps us get an idea of where your site is as a whole. If we see that 90% of your providers would like, let's say, keep with proficiency 3 around lab tests, if 90% of your providers say that they would like that in their individualized training plan, they can continue that individualized learning, but we can also say this might be a good proficiency to include in the group training plan as a whole, because so many of your providers wanted to include it into their own individual training plan. So it's really a great tool both for providers to use to really hone in on where they want that training, and then for us and for the clinical learning leaders to use as they start to develop sort of the group sessions and the group training plans, and whatever frequency those are going to be done at the site. So again, this is the self-assessments, and this again will be sent to you electronically. And we ask that your providers do fill this out to the best of their ability. And just as a few reminders, there are some supplemental questions here in the back that we would like to ask of your individual providers. So please just double check that they do continue on and answer these questions. Again, these are very similar to what was on the group training, the initial training needs assessment that we sent out, that much larger sort of whole site needs assessment. But this is really asking the providers sort of their self-study availability, their group training availability. We definitely know that not all providers are in the office 5 days a week. Not all providers are at one site 5 days a week. So this helps us to get a little bit more of a clear idea as to the provider schedule and availability. And it also tells us a little bit more about what the personal provider's experience has been with HIV training, how they communicate with experts, and also their learning preferences as well. So just a reminder to make sure that they complete both parts, not only this rate and checkbox piece, but also the remaining supplemental questions as well. I think I'm going to ask at this point if anybody has any questions about the self-assessment piece. Really, that is the next step here in the process. We're going to be sending out these self-assessments to you all, and in hopes that you'll disseminate them to the members of the care team that you've identified as participating in this HIV clinical training, and then be able to send it back to us so that we'll be able to collate all the data that we've received and present you with a very nice overview of the training needs of the providers at your site by the time you come out here to DC for the April meeting. Does anybody have any questions?
This is Angela. We submitted some questions online, but okay. I'll ask you.
Right.
Should we consider having some of our pharmacists involved in this, as well as our licensed clinical social worker?
You know, the pharmacists are definitely, they're welcome to be involved. Our goal is really providers. The clinical social workers may benefit from some of the foundation's proficiencies that are available. The provider proficiencies are very much geared towards sort of prescribing, diagnosis, and management, and also the RN and the LPNs. Those proficiencies are very geared towards nursing and sort of the nursing component of HIV care. So I'm not sure if knowledge, I'm a firm believer that knowledge is knowledge, and that anybody who wants to learn, they should have that available to them. But some of the proficiencies are very geared towards specifically the roles of the providers and the roles of the nursing staff. But the foundations piece is really open to anybody in the clinic, because it provides a very foundational piece of HIV knowledge, like I said, including epidemiology, and testing and HIV kind of pathophysiology, general stuff like that. Now, the pharmacists, I recognize that pharmacists function very differently depending on what site they work at and what their scope or what their job description is at various sites. So I think that that would be something that you could determine. We'd be happy to send you the assessments for them. We don't have a specific provider, we don't have a specific pharmacy assessment, but they could certainly look through the provider piece, and if they find anything that might be of interest to them, they could definitely fill it out. Does that help?
That helps. We have another question.
Okay, great.
Does the number of proficiencies in your individualized training plan correlate with how much time is involved? For example, if you choose multiple proficiencies you want to include in your plan, does that mean you're going to have more work involved?
Yeah, probably.
Okay.
Yeah. Yeah. So we expect, that the proficiencies could take anywhere from 30 minutes to an hour to really read all of the content. We've tried to not overload them with content. We've really tried to sort of break them out that's why you kind of see there's a lot of proficiencies, because we really tried to break them out as best we could so that, you could really just get a nice chunk of info that you need. Maybe go through one CME that might take an hour by the individual provider. There are some that are a little higher level proficiencies, like actual management of hepatitis C and HIV co-infection, which, as you know, there's entire fellowship programs around. So those may take a little bit longer to move through, but yeah, definitely that would be something to take into consideration. Any other questions?
Another question.
Great.
Well, I was just wondering, how often as far as those proficiencies, how often should we get online and try to complete those? Every week? Does it depend on how many there are involved?
Yeah, it would depend on how many there are involved. Again, the goal is to really have the individual clinician sort of work through their own individual training plan, but also there be some sort of an opportunity for group training at the site. We realize that group time is very precious at your sites. Some sites have said that they'll be willing to devote an hour a month to some kind of group training where they watch one of our webinars and maybe do a discussion around it. So that would be also something to take into consideration. Some of your proficiencies may be captured in one of the group trainings, but that would be something that you would probably want to try to figure out on your own. And again, the resources, the core resources are there. Most of what you need will be in those core resources, and then the supplemental resources are just available for you to sort of, if you want to watch an extra webinar about antiretroviral first-line failure, that would be available to you. You don't necessarily need to do it to get the core information that you need.
You mentioned if many of us had the same proficiencies in individualized training plans, we could have that as a group session then?
Yeah, definitely. And what we would do is once we get these assessments back, we'll be able to look at all of that. And if it's, we have developed webinars, our staff has developed webinars around some of these proficiencies. We may be able to identify another group activity, and if not, we can, one of our goals is to discuss with your local AETCs if there's a group activity they could provide around those proficiencies. So we'll be able to hopefully tell you, which ones might be a good group training activity for you.
Thank you.
Yeah, no problem. Anybody else?
This is Angela again. So it's my understanding that we need to submit the names of those who are interested in participating first, correct?
Yeah, and I'm sorry, Angela, where are you calling from again?
We're from Health Delivery in Saginaw, Michigan, and we have not submitted our providers because we wanted to obtain this information so that we could articulate it clearer to them than what we have been in the past week or so.
I gotcha. Okay. Have you submitted your training needs assessment yet?
Yes.
Okay. Okay, and I apologize. I was traveling last week, so I'm still trying to catch up with everybody. Yes. So if you could submit to us, I believe on the training needs assessment there was a place for you all to submit your care team members by discipline. So if you want, if you left that part blank, that's totally okay. If you want to just go back and submit put those names on there, and you could submit it again to us, that would be great. And then that way at least we'll have a record, and then when we'll know exactly which assessments to send out to you.
All right. Thank you.
Sure. Anybody else have any questions?
This is Dr. Wright Francis from St. Thomas Eastern Medical Center. We had several people in the room. Does it matter whether or not their names are listed under attendees, or how can we document that they were here, or it's not necessary?
For this call?
Yes.
I'm gonna look. If you'd like, you can just send me an email with their names. I'm sorry, yeah, because I'm not the technical expert here, so let me just figure out really quickly what the best way to do that is for the evaluation team.
Right, because I was trying to add it on to attendees, but it doesn't look like I can type anymore.
Okay, no problem. And let me just really quickly just check with the evaluation team that they got everybody. Yeah. Okay, yeah, I'm getting the thumbs up from Nico over here saying that they'll take care of it for you.
Send an email to whom?
You could just send an email to me. I'm pretty sure that our project assistants have gotten the names down already. But if you could just send an email to me, Stefan at healthhiv.org, that'd be great, and we'll just double check.
STEPHAN?
EN. Anybody
Stefan
else?
at HIV.org?
Sorry, it's Stefan at healthhiv.org.
Okay, thank you.
Sure.
Stefan, I have one more question.
Of course, go for it.
Brent is our co-medical director here, and we were considering having a dentist participate.
Okay.
Is that appropriate?
That's definitely appropriate. Again, there are some proficiencies in the training package that are focused on oral health. Now, they're not at the level, they're geared towards the level of primary care providers, so really kind of like screening for oral health care needs, doing an oral health exam. They may not be specific towards that level of dentistry that is very important, but they're welcome to participate. There are some things that they may be able to find very useful here since they are prescribing clinicians. So definitely you can include them, and they can go through and look through which ones they would want to which proficiencies they'd want to participate in. Great questions. Keep them coming if there's any more.
This is Brent again.
You're going to send us this proficiencies list after the webinar?
So what we'll do is once we're off the call, we'll go ahead and send it to whoever's been identified as the clinical learning leader for the sites. We will send the self-assessments and proficiency list, what we're looking at on the screen right now, and we'll also go ahead and send you a complete list of the proficiencies just so that you can kind of see the entire proficiency list for everybody so that you can get an idea of that. But we'll send that out by the end of the day today so that you can have it. And then you're always free to give me a call or send me an email if you need anything at all around assistance with filling out the applications, or you think of some questions that you might have. And also Mona as well, Mona Moore as well.
Stefan, what's going to be the deadline to complete these self-assessments?
Let me quickly double check. We do need to have them back for sure in enough time to analyze them prior to the community meeting. If you all think you could have them, today is, I believe, the 12th. If you all think you could have them done in the next 2 weeks, that would be very helpful.
All right.
Thank you.
Sure. Again, I know that, sometimes tracking down providers is really difficult, so we want to give you as much time to do this as well. So if you think you could get them done in the next 2 weeks, that would be great.
Do you want us to fax them?
You can fax them if you want to. We've had people FedEx them, and we go ahead and pay for it. If there's a way that you could do it electronically, you could do that as well. Any way that's easiest for you to get them back to us is fine.
Will they be in an electronic form, like a PDF that you can type in, or should we just scan them?
They will be. Let me double check on that really quick for you. Hang on one second. Okay, all my experts say that it's a fillable form that you can fill out online and send back to us. And is it a PDF, Andrea? We can PDF it for you if that's easiest.
Yes, would you do that for health delivery? Because it would be easier for us to monitor.
No problem.
I guess I have one more question, Stefan. So if providers complete it online, how do I know that they have completed it? I'm the one responsible for this project, so will somebody email me or what?
Yeah, what we'll do is when the provider completes it, and they can either send it back to you or they can send it directly to us and CC you on it. We'll keep track of all of them that come in and compare them to that list that you send us of all of the care team members. So if we look at it and we say, oh, we're missing a training or a self-assessment from, nurse practitioner Perez because he's always delinquent on this stuff, we'll give you a call and let you know, and then you can speak to that provider to make sure we get it in.
Okay, the group just decided that the providers will send them to me, and we'll send them as a group, and that way we can track down the ones who haven't completed it in a timely manner. So that's what we'll do.
Okay, great.
We'll send to you on that one.
Okay, and Dr. Wright Francis, does it make sense for you as well to send to in a PDF format electronically?
Yes, that'd be great.
Okay. Okay, fantastic.
And we'll send them back in bulk as well.
Okay, great. Fantastic. Great, okay. If there's any other questions? Okay. All right, well, great. Well, thanks again so much for taking the time for the call today. Hopefully it's sunny and nice where all of you are. It's beautiful here. And hope that you all have a great rest of the day. So we're going to get those out to the self-assessments and the full proficiency list out to you guys so that you can get started disseminating them out to your care team.
And one more thing, you're going to send out for all the stages, because I think for here at East End, we have people in different stages.
For sure, yeah. We're going to take a look at your training, that original list that you sent us of the care team, and we'll send out the right assessments that you need, and then we'll send out a whole big overview of all the proficiencies just so that you could take a look at them.
Right, because as far as the self-assessment tool, I see now that I probably didn't fill it out correctly. We just, like I said, we have one provider who is at stage 3, and that's what we checked, but we realized the rest of the
Right.
organization is just above foundation.
Okay.
And we're really going to try to get everybody in. So I'll make the additions to the list because we really want everybody to participate.
Okay, fantastic. No problem.
All right?
Okay, great. Okay, sounds good. All righty, we'll get this information out to you. Thanks again, everybody.
All right, thank you.
All righty. Bye-bye.